Welcome to week 10, our live chat once again. Oh, it's a little rhyme. Okay. This week, we're talking about workplace liabilities and legalities. And there are three main reasons why you need to learn about these employment-oriented laws. Now, the rest of the term, we've been talking about laws that directly impact or affect the job you are training to do, which is medical billing and coding. However, these particular laws are regarding human resources. The HR laws that have to do with employment. So why do you need to know that? You're not studying to become an HR manager. Well, there are three reasons. Number one, at some point you may become the manager of the department, and not all facilities have HR do the hiring. Many facilities have the manager of the department do the hiring, because you will know what you need, what characteristics, what skills, what particular certifications and things like that you need from a potential employee. And you also need to be able to figure out if this person is going to fit in the culture of the department that you have established. Okay. You also need to know about these laws when and if you decide to own your own company, because you may decide to establish a billing and coding company, which is great. A lot of our alumni do that. But if that's the case and you have to hire anybody, you need to know the law. You're not exempt. You need to know the law. And of course, as an employee, when you go to work for someone else, it's very important that you know your rights, you know the laws, so you can make sure that that company that you're working for is treating you properly and legally. Okay, so let's just do an overview of these laws. Okay, the first one is the doctrine of corporate negligence, and that is that the facility can be held liable for the competence of their staff. So in other words, as an administrator or manager, you must ensure the quality of your staff and the quality of their work, because not only can they get in trouble for doing an improper job, you can get in trouble as well. And if you're in a medical practice, it might be the physician, or if you're in a hospital, it might be the corporation that owns the hospital, certainly the board of directors and the CEO and the E-suite. Okay, so this is very important that you remember that you are legally liable for the quality of work that your staff does or does not do. Second is the Equal Employment Opportunity Act. You may know this by the letters EEOC, which stands for the Equal Employment Opportunity Commission. This is a federal law, so it's valid in all 50 states, that regulates hiring and firing of individuals based on race, gender, or age. So that means you cannot hire or not hire somebody based on this information. What that means is you must be very careful about what questions you ask in an interview. And if somebody submits a resume or an application to work for you, you have to be very careful that this does not reveal any information that may affect your decision to hire this person. And then certainly once they're working for you, you have to be careful about that. Now you may say, well, there are people have to put their names on their application and on their resume, and that's absolutely true. And very often, you can tell somebody's gender from their name. That is absolutely true. But you don't want to go out of your way to have this become an issue with regard to any of these things. So it's very important that you protect yourself when you are looking to hire as you review resumes and cover letters. Okay. All right. The Occupational Safety and Health Act, you may know more commonly as OSHA. And OSHA is a law, again, a federal law, that requires employers to develop and implement whatever is necessary to ensure a safe workplace and a healthy place of employment for all staff. Now, it's very interesting. Just last night, I saw on the news that there are some employers that are thinking about mandating that staff members have the COVID vaccine or not permit them to come back to work. And this becomes, and of course, they're discussing it because there are questions as to whether or not it can be legally accomplished. And so you can see here in OSHA that OSHA requires the employer to make sure that the workplace is safe and healthy for all members of the staff, which would, of course, mean that they are required to prevent you from getting a contagious disease. That makes sense, right? Okay. But at the same time, this same exact action can impede upon an individual's freedom as to whether or not they want to get the vaccine, because that should be a personal decision. Now, I was talking to a friend of mine, and I said that this reminds me of when I first went to work at the hospital, and they said, you have a choice. You can either get a flu vaccine or you can always wear a mask. And this was several years ago. So I am thinking that this might be carried over to COVID, where an employee who has to work in the workplace and cannot work remotely can be given an option: either get the vaccine or you must wear a mask all of the time. And that sounds reasonable.
Dr.
And
Sapien.
yes, Nikki?
Now they have it where it's mandatory. You have to get the shot, or it's no longer you can waiver and wear a mask
Oh,
for the
really?
flu. The hospital I work at, yeah, the hospital I work at is mandatory. You have to get the flu vaccine. If you don't get the flu vaccine, it's possible termination. Also, if you take sick, you will not get paid. You're not allowed to do
Wow.
PTO sick time for the flu.
Very
Yeah,
interesting. Now, let me ask you
you have
this.
to at all time, you have to admit, the only way you can waiver the flu vaccine at McLeod
Yeah.
hospital system is religious reason and medical reason are the only two ways.
Let me ask you this. Are they offering the vaccines at the hospital?
Yes. Which vaccine?
The COVID.
Yes, the COVID. What they did when they first started with the COVID vaccine was they
Mm-hmm.
had who they determined to be frontline to get
Okay.
first.
Right.
I was, because I worked, that was the ICU, NICU, the units, the ER. They they went first, so we went first. Then you had the other hospital staff after that. Now, what Clarendon did, which is different from what Prisma is doing here in Sumter, is I'll drop you the I put in the morning. What they're doing different is that they are doing vouchers
Oh,
for it's first come first serve vouchers for the public.
wow.
So
Cool.
it's still age requirement, but you have to do vouchers.
So to kind of
So
get you
like on
through the
Monday through,
muck of the waiting. That's
yeah.
very good. And
So
all in all, it is promoting the good health and safety for you, the staff, as well as the public. And that's exactly, especially for those of us in who work in healthcare, that's exactly what our responsibilities are. Very good. Thank you for
be-
sharing that.
because you still have this, yeah, you still have staff that won't take the vaccine for the COVID.
Well, I understand that. And you
Yeah.
know, that that is going to be very interesting as to where that goes. The same way schools are dealing with anti-vaxxer moms who don't want to get their or parents who don't want to get their children the MMR. Um, it's not because of health reasons and it's not because of religious reasons. And so this is going to be a new aspect to our communities, which are these individuals who do not believe in the science, who do not want to benefit from the science, and therefore not only endanger themselves but endanger others. So I think we're going to. This is a new thing. So I think we're going to find our way through this because we do, you know? Okay, thank you very much for
Yes,
sharing that. That
ma'am.
was great. Okay, the
You're
Americans with
welcome.
Disabilities Act is a federal law that offers protection from prejudice in employment for individuals documented with a disability. I hope that none of you can remember before this law was passed that somebody could deny somebody, a perfectly intelligent, capable person, could deny somebody a job because they were in a wheelchair or on crutches, which is such nonsense. Okay. The only way you can deny somebody a job because of their disability is if that disability directly impairs their ability to do the specific job. So, for example, we're all here, we're all in medical coding and billing, and you all have had experience now with coding, and you know how important it is to get all the characters, the letters, and the numbers in the exact order to report what it is you are reporting. So, therefore, someone with dyslexia could not be a coder because dyslexia, they confuse the order of letters and numbers. So that's just an example of what would be a valid waiver of the ADA. But somebody with only one arm could certainly still be a coder. Somebody who uses a wheelchair could certainly be a coder. And we want that because the more people we have that are capable of working, should be working, should be contributing members of our society. And they want to be. Okay. All right. Wage and hour laws are very, very important. And these regulations govern how much you pay your staff members. So that's wages. So this might be a salary or it might be per hour. All right. And then how that amount is calculated, as in the number of hours in a week or whatever. This must be spelled out and very specific at the time that you hire the individual, and the organization must follow the law with regard to things like minimum wage, okay? And this is very important, that if you know of anyone who is not being paid their fair amount according to what was agreed upon in when they were hired, they should make a complaint. And I will tell you, companies are scared witless of a wage and hour investigation. Excuse me. Okay, but the fact is you got to stand up for yourself. All right. Family Medical Leave Act, you may know this by its initials, FMLA. And this is a federal law directing companies to provide unpaid leave to employees with a personal or family health crisis. Okay? Unpaid. There is no guarantee that you'll continue to get your salary or your money, but you are guaranteed a job when you get back of an equal or greater level. Okay? That is very important. Equal or higher level when you get back. And it is limited by the number of weeks. Now, there have been organizations that offer paid leave, FMLA leave. There are organizations that do partial, whatever. It's an important thing for you to know in case. And it's like one of the things that is included in this is the birth of a baby, but that also includes the adoption of a child. Okay. It also works for both mommy and daddy. So it's very important that you know what your rights are, and then you can decide whether or not you want to take advantage of what this law offers. Okay. So those are the laws, the employment laws that I wanted to review with you today. And remember what I said, it's important that you understand these laws both as an employee as well as a current or future manager or a current and future business owner. You must know the law. And if you're thinking about opening your own business, the truth is that you may find out that there are many people who start a business who go out of business in the first year, and that is very true. The reason is more important than the statistic. The reason is because these new business owners do not know the other laws that impact their business, and they go out of business because the government puts them out of business because they're not following the law. Okay? So this is your responsibility. If you want to open your own medical billing and coding and claims business, that's great. And of course, you need to know about HIPAA, and you need to know about the Business Associates Contract, and you need to know about the False Claims Act. But you also need to know all of these employment laws and a few extra other ones too. So, sorry. Okay. So, this week in week 10, no discussion board. Yay! But you do have, if you haven't taken it already, test number 3 closes tonight at 11:59 p.m. So if you haven't done it yet, get her done. Okay? All right.
Yes, ma'am.
Yes. Nikki?
No, I was agreeing with you for the test.
Oh, good. Did you do it yet?
No, ma'am, I'm going to do, I had to babysit today, so I'll do it when I get home.
Okay, that's fine. Yeah, just tell those munchkins in your car. I saw them. You tell those munchkins in your car not to help you with the test. They got to take it there themselves. Okay?
That's my ninth grader. She already said she's not helping.
Good for her. You're raising a child with integrity. That is excellent. I would expect nothing less, honestly. Okay, then you're going to do your chapter 10 homework. That's fun. And then there is, I think I put a link to Osha for workplace safety and healthcare. This is also important, especially you work in a hospital. OSHA is a federal law, and hospitals, all businesses, regardless of the size, must follow certain regulations to keep the workplace safe for staff members. Okay, you know, things like sharps boxes and infection control. There's a whole long list of stuff, and this OSHA website is really very good. Lots of pretty color pictures, and they really break things down. It's easy to understand. So definitely take a look at that, because that's your workplace. All right. So other than that, it's important that you become educated in greater things other than your just specific area of expertise. It's just the way the world is, and that's what is required of you. That is for your benefit. That's why we make you take all these extra classes. Oh, all right. Well, I want you to have a safe evening and be good. Particularly you, Nikki. The kids, I'm sure, are always good, right? Maybe not.
Yeah, you're always good. She said, yeah. She's nodding her head, yes.
Yes, absolutely. All right, you all have a good evening. Stay well, stay safe, and I will see you next week, okay?
Okay, you too.
Bye.
Bye-bye.